what is it important for people to know when it comes to eating out or even preparing your own food to avoid getting that?
You said the key word. The key word is try to avoid. It's difficult to tell. There's no way you can tell if a food contaminated with salmonella is actually contaminated, so it's odorless. So you can have a piece of uncooked meat and it would smell perfectly fine. So first thing is, if you are going to a restaurant, make sure that you don't order raw meat. If you got chicken and it's not well cooked, it's pink, take it back, turn it back, and ask them to cook it again. And same, unpasteurized milk or raw eggs, you need to avoid. When you're cooking, most important thing is, again, you will not know if your food is contaminated or not. So then the key there is handling the food adequately. So first one, wash your hands with water and soap when you're handling the uncooked meal or cooked food. And then when you're cooking it, make sure that it's well cooked. If you are storing your food, don't mix it. So don't put uncooked meat or poultry with food that is already cooked, because then you can cross-contaminate the food. And after you are done handling the uncooked meals or food, wash your hands thoroughly. At home, avoid exposure of uncooked poultry, meat, etc. to kids, because the ones that really get very ill or potentially can get very ill are kids under the age of 5, or then adults above the age of 65. Or if you have an individual that is immune compromised with chronic illness as well, those are the individuals that might get really sick. So avoiding contact as well.
Can salmonella be deadly?
Yes. Salmonella usually is a mild infection. So there's a wide variety. You can get contamination and just be contaminated and be completely asymptomatic. Or you can have mild symptoms, a little bit of abdominal discomfort, mild diarrhea. It can progress, or you can have a more severe illness like having severe abdominal pain, severe diarrhea, dehydration, nausea, and vomiting. And if the infection becomes systemic, that means moving from the intestine to the bloodstream, then it can become lethal.
How long does it take to, if you're going to see symptoms typically, how long will that take?
It's usually between 12 hours and 72 hours. So usually you eat, and later that night or early the next day you start feeling the symptoms, and up to 2 to 3 days you can start feeling the symptoms.
And how long does it take for salmonella to leave your body or for you to purge it? How does that work?
About 4 days to 7 days. So in about a week you should be symptom free if you get a disease that your body can handle, and that it's not a non-threatening disease. About 5 days to a week maybe.
Okay. And then if you do contract salmonella, do you have to have medicine in order to fight it, or will it naturally go away on its own?
That's a very good question. So most cases of salmonella, you will have the diarrhea, the crampy abdominal pain, vomiting, diarrhea, and the symptoms will go away by just basically avoiding eating, having some soup, good hydration, and that's it. Eventually, symptoms can go away. So usually we do not use antibiotics to treat salmonella. Only in severe cases, people that get systemic infections, then those are the ones that will need antibiotics. But most cases will not need antibiotics. So medications kind of to help a little bit with the diarrhea, maybe with the vomiting could be used. But most of the time it's what we call self-limiting. Eventually you'll get well without needing specific medications.
Anything else you feel like people should know, or that I should have touched on?
I think the most important thing is, what other sources are for salmonella. So here in West Texas, reptiles. So handling snakes, turtles, contaminated feces of those animals can get in their skin. And if you are in a petting zoo and you touch a reptile, or you're handling a turtle, specifically kids under the age of 5, or adults more than 65, or immune compromised patients, they really have to wash their hands immediately and avoid contact between petting the animal and contact in your mouth, because that's when you can get infected, and those are the higher risk individuals for infection.
So the only way you can contract it, though, is if it enters your body through your mouth. Like you can't, it's not going to come through my hands.
It's a really good question. So if you have, first you need contact with contaminated food material or feces. And if you don't have direct contact and you don't put your hands in your mouth, usually you will not get contaminated by just walking by somebody that has the infection. You need that direct contact. So washing your hands, those are the major precautions. Wash your hands, water and soap, good sanitation, that's basically the way, and cooking well the food, that's the most important thing.
Perfect. Anything else?
I think that's the most important thing, just prevention.